Good morning, and thank you for joining us. I am Kiana Thomason, President and CEO. We are excited that you're joining us today for our Purpose Plan launch and for our virtual Q&A to talk about your questions and our thoughts with respect to those. Before we jump into the presentation, we'd like to do a check-in. We imagine that different thoughts and feelings may come up for you about our new Purpose Plan, and we want to make space for that at the outset of our time together. So we're going to use a word cloud platform. You may either scan the QR code that's on the screen with your phone, or you can click on the link in the chat to share.
1 second, I'm going to pull up that link really quick.
Thank you. So while Ross is pulling that up, the question is, share a word that best describes how you are feeling about Health Forward's new purpose plan. Just one word. Again, you can click on the link in the chat, or you can scan the QR code with your phone. We're going to give just a couple of minutes for you to do that, and we'll see what comes up for us. For those of you who are dropping your feeling in the chat, go ahead and drop it via the word cloud platform using the QR code so that we can get the word cloud, or you can click on the link and drop it in there. All right, so feelings are coming in. Excited, curious, energized, hopeful, concerned, inclusive, forward, equity, hesitant, movement, apprehensive, bold, worried, grateful. Thank you so much for engaging with us in this way. Again, we acknowledge that many feelings come up for us as we consider change, including ourselves at Health Forward Foundation. So again, we wanted to make space for that. We trust that this session will deepen the excitement for those of you who are, will clarify ambiguity, and or facilitate understanding where there are feelings of concern. Also know that our impact team is available and will connect with partners one-on-one over the next couple of months to talk through our transition with you. So just know there are multiple ways to check in and allow us to hear your thoughts and engage with you concerning this change. With that, let's jump into the presentation. Ross, I'll give you a moment to cue that back up. Let's talk about our new purpose.
Sorry, Q, 1 second.
No worries, take your time. Best laid plans always go awry. We'll be flexible today.
While Ross is pulling that up, I'll remind everyone that we're going to be monitoring the chat for questions. So if something comes up as you're listening, feel free to drop it in there. And if we haven't addressed it during the presentation, we will try to as time allows.
Thanks so much, Corey. Our new purpose. Every day, we work to support and build inclusive, powerful, and healthy communities characterized by racial equity and economically just systems. This is our new purpose, and it speaks to what is true when health equity exists. Our purpose clarifies Health Forward's reason for being. While our mission communicates our what and our how, our purpose is our why. It is embedded in everything we do and occupies our mindset, will guide our work, and certainly our stewardship. Our vision has not changed. Healthy people and healthy communities remains our view of the future. Our tactics and methods, however, are evolving. Our mission is to achieve health equity and secure a fair and just region through leadership, advocacy, and resources. I really appreciate that our inaugural board and early board members had the wisdom and the foresight to know that resources or grant making alone is insufficient to achieve our aims, that using our voice, our power, our political will, through leadership, advocacy, and resources is necessary to achieve this vision. And today, of course, there's never been a better time or more opportune time for us to exercise our full toolkit of leadership, advocacy, and resources. Philanthropy requires a strong commitment to values. At Health Forward, we honor and trust the expertise of our community partners and staff to do our best work. We strive to align with our words by cultivating authentic relationships grounded in honesty, listening, and power sharing. We commit to boldly advance equity, inclusion, and anti-racism. In doing so, we will act with mindfulness, intention, and courage, and ask ourselves, how does racism show up here, internally and within our community systems? We are certainly better and stronger together with you, and knowing that you have expertise in health equity, we will partner broadly to support and build inclusive, powerful, and healthy communities. We learn, grow, and evolve every day through curiosity, risk-taking, and innovation. And we learn from stakeholders across all sectors, centering the voices of those closest to the problems. And we see transformative ideas and change course purposefully. And last, but most importantly, we are good stewards, committed to transparent, equitable, and responsible distribution of resources. Many are curious about our purpose alignment journey. It's important that you know that our journey was catalyzed by our board of directors. A strong foundation was poured years ago when our inaugural board committed to diversity and inclusion, ensuring diverse representation among the board, the staff, and the Community Advisory Council. Today, it's who we are. It's how we work, and our board is comprised of a multi-identity team, including over 50% people of color. In 2019, through the CEO search and my selection, the board made very clear the imperative of equity, transformation, and impact as they projected Health Forward into its future. And in 2020, well before the glaring health injustices highlighted by the pandemic for people of color, and before the racial awakening sparked by the murders of George Floyd and Ahmaud Arbery and others, the board had already prioritized accountability and equity by creating the Equity Committee of the board. And in 2021, after much learning, reflecting, and visioning, the board established and approved our new purpose. And right now, our board has prioritized deepening their learning and their commitment around the principles of purpose-led governance, which includes purpose before organization, respect for the ecosystem in which we all work, equity as a mindset, and authorized power and voice as we pursue our work and our impact. From a staff perspective, we have been quite busy. In fact, I believe our communications team is considering a t-shirt for staff that says we survived purpose alignment. There's been a lot going on for us over the past 2 years. The most energizing element of that work has been hearing from you. Our commitment is to work with and for and not for our community. And along those lines, we engaged in over 100 interviews with a broad array of stakeholders to learn about what you see as our bright spots and our opportunities. We also let national and local data including lived experience, which is data, and research to guide us. And we took stock of our own expertise and all of the great areas to consider for focus. And we asked ourselves, what is Health Forward's unique position as we move forward? What are we uniquely positioned to do? And finally, with the help of many local and national learning and planning partners, we've done and will continue to do the work. Our purpose is zealous and it is heavy. So we've invested much time and resources in pursuit of a high trust culture, which never ends, never stop pursuing that. We've engaged with deep cross-cutting analysis about structural racism, and we've chartered our course strategically and continue our learnings with respect to adaptive leadership is what we're currently learning about. So there's not a week that goes by, next slide, Ross, that our inboxes are not filled with headlines and data that is in direct support of our new direction. So in view of overwhelming evidence, we determined that the highest and best use of philanthropy, health philanthropy, is to pursue health equity through pathways of racial equity and economic justice, with the goal of creating health and wealth. This direction is rooted in data. Race and economic equity are the most critical drivers of health and underpin health injustice. And we know that as race is a social construct, that racism, not race, is the primary determinant of health for people of color, causing communities of color to be unwell. If the pandemic disparities haven't taught us, we can look at current and historical data on life expectancy, as you see on the slide, the uninsurance rate, and the incidence of chronic conditions across our nation, the disparities in COVID and in our region. They are systemically higher for people of color due to community conditions. The Brookings Institute and other studies have evidence that the racial wealth gap, speaking of net worth specifically, on average for white families is 10 times greater than the average for Black families, due to systematic exclusion from income and wealth generation for people of color. And income and wealth are significant drivers of health outcomes for all people of all races and ethnicities. Research has shown that increases in levels of income or wealth correspond with improvements in health. If you haven't seen it, I strongly encourage you to check out the latest issue of Health Affairs, a nationally esteemed peer-reviewed journal, which has dedicated its entire February issue to structural racism's impact on health. Excuse me a minute, mouth's getting a little dry. So for years now, Health Forward has worked effectively with our partners through meaningful programs and organizations, working on downstream factors like clinical care and midstream on individual social needs. No doubt, this has been great work, which we will continue to support in new ways. Working at these levels have delivered strong individual impact, but that impact at the individual level is insufficient to make health equity a reality for the Kansas City region. The World Health Organization, in its report, Closing the Gap in a Generation, stated very clearly, reducing health inequities is an ethical imperative, and that social justice and injustice is killing people on a grand scale. Working at the intersections of health and wealth will require us to go upstream to impact community conditions like healthy housing and affordable home ownership, ensuring communities in our region have access to broadband and the digital economy, amplifying power and voice through civic engagement, and increasing the representation of Black, Brown, and rural talent in the health sciences workforce. To be effective in health equity, organizations must prioritize for impact. Ross is going to cue a video that will share more about this prioritization.
A few years ago, I had an experience that forever changed the way I design projects, and it saved me so much time and frustration that I want to share it with every teacher I know. For years when I designed projects, like 10% of the students seemed to be okay no matter how poorly I designed it. You know the type of student I'm talking about. They're going to be fine. But the rest of the students were either totally lost or just unclear about the overall purpose of the project. So my transformation in how I plan projects occurred during a meeting in Washington, D.C. I was chaperoning a group of students from my school in San Antonio, Texas. The students had traveled to D.C. to bring ideas back to San Antonio so that we could make spaces in our community more accessible to a wider range of people. As part of the students' exploration, they met with a group of people in the Department of Labor who focus on the Americans with Disabilities Act. When we arrived, the students asked the adults, "What's the first thing you think about when you design for accessibility?" Quickly, a woman responded, "Well, let me ask y'all a question." Actually, I don't think she said y'all, but I'm from Texas, so we're going to go with it. She asked, "How many of y'all used a curb cut on your way to our offices today?" You know, the curb cut, it's the part of the curb that's like a little ramp between the street and the sidewalk, so you don't have to step up. Several of us raised our hands. We'd brought our luggage, so most of us actually had used several curb cuts as we rolled our bags from the streets to the sidewalks. "Great," she said. "And who else uses the curb cut?" One student answered, "Well, parents pushing strollers." And another said, "Well, people on skateboards or on bikes, or people delivering packages." And the students had example after example of other people who use the curb cut. And she said, "Exactly. Curb cuts were made specifically for people like me. Like, I'm in a wheelchair. I can't access the curb without one, but lots of other people benefit from them." So when we design for equity and access, we think about the extreme user. In other words, we think about the person who doesn't have full access unless we change the design specifically for them. And the cool thing is, when we design this way, we end up opening pathways for access for lots of other people we hadn't even considered. So she finished her story, but each of the adults at the table had a different disability, and all of them had personal stories just like the curb cut. I'll give one more example. Next, a man asked, "Well, how many of you have texted somebody today?" And of course, like, every hand immediately shot up, and he said, "Awesome. Did you know that texting was made for people like me who are in the deaf community?" I didn't know that. I mean, it was fascinating. Each adult at the table told a different story about how something specifically designed for their communities had made all of our lives a little better. It was eye-opening for me as a teacher. As I listened to this conversation, I wondered if I ever planned like this in my classroom. I thought about it and I realized that I didn't. When I planned projects, I tried to think about all of my students, all 100 plus of them. But by thinking of all of them, I ended up not deeply considering a single one. So I tried something. For my next project, I designed it from start to finish with one single student in mind. And I'll be honest with you, he was a student who'd been frustrating the living daylights out of me. And to be fair, he definitely let it known he had similar feelings about me. We weren't doing great. But after the redesign of the project, the difference in our relationship was dramatic. That student, the extreme user, engaged in the learning more confidently than I'd ever seen before. And the students who didn't have to have all the curb cuts went a lot further. So by thinking of this one student, the student furthest from opportunity, I gave greater clarity to all. Scaffolds I designed for him, like turn-in talks, sentence starters, more frequent checks for understanding, and intentional groupings led to all students creating better products and deepening their understanding. With more confidence and clarity, the students engaged in richer discussion, rigorous inquiry, and they just really, really worked hard because they knew what they were doing. So what I learned from this experience is that by thinking deeply about the needs of one extreme user, we can open up pathways of success for all students.
Thank you, Ross. When we design for equity and access, all people thrive. We have crafted a purpose plan designed to create inclusive, powerful, and healthy communities throughout our region. And as the video highlighted, because equity is the rising tide that lifts all boats, within Health Forward's communities of focus, we prioritize people who experience the greatest injustices in health outcomes, including people of color whose outcomes are shaped by structural racism and other socioeconomic conditions, and people in rural communities where systemic barriers hinder their health. As no person clearly is a single identity individual, these communities often overlap with people of varied identities who experience economic security or insecurity rather, live in marginalized conditions, and those that have been systemically barred from accessing high quality care that's affordable, equitable, and trauma-informed. So we know that centering these communities will improve the health of everyone. And together, our region has the resources for everyone to thrive. There is enough to go around. We will address a few questions we've received concerning our communities of focus in the question and answer segment, just a little bit later in our presentation. Now, I'd like to introduce Angie Williams, Director of Community Investment and Impact, who will talk about the strategies in our plan and what's coming next. Angie.
Wonderful. Thank you, Kiana, and good morning to everyone. I'd like to take the time just to thank you for sitting through and sitting with us this morning to learn more about our overall plan. Ross, you can certainly move with the next slide. Many of you have probably seen this slide or this document before as a part of our launch that we did in early January. There's a lot there. Today, we'll walk through it a little bit together using kind of a high-level lens to gain a better understanding of what is meant by all that you see here on the page. As Kiana spoke a little bit earlier, she shared that we've been through a process over the last 18 months to reach this point. We've approached this very strategically and with the understanding that this is our 5-year purpose plan with the intention of having a 10-year impact. We'll phase our work based on the research that we receive from our community stakeholders, the feedback that we've received there, but most importantly around community need. Our intention is to work with and not for, so that what you see or read is a compilation of voices raised to meet an intended impact. So we'll start with the light gray bubble that you see and speak to what we expect to see or the impact we will make when we've had or seen success. So that would look like high quality, equitable community health ecosystem. It would look like strong community organizations and voices, as well as equitable and just places that foster health and economic advancement. Moving to our dark gray bubble, our first purpose area is what we call platform. Platform is what we've determined as the overarching efforts that hold our greatest intention and recognition to understand and catalyze action around racial equity, economic inclusion, and health equity. This is truly at the core of our work. It is with this understanding we stand up and integrate this effort through place, people, and power. So let's take a look at each of the purpose areas, and we'll start with place. We know that there's a pathway to economic inclusion through home ownership. Advancing safe, healthy, and affordable housing and home ownership is our aim to both health and wealth creation. This is a new pivotal space for us to enter into. Also important, or also an important focus, I should say, in this area is the reduction in disparities in digital access and in literacy. Advancing digital access by addressing equity, broadband issues, and through our policy work, we will be key in this purpose area. This work will be key in this purpose area, for sure. Shifting to people. It's the people's purpose. Say aloud. We've teased one another in the organization that there are a lot of P's. And I just went through that whole purple people pecker thing just now in trying to say people. It's the people purpose area, which is where we think of, or we start to work in advancing equity-centered whole person care. And you've heard Kiana mention whole person care in the presentation. You also may have heard it come up in our video. And so I wanted to just share a little bit when we speak to whole person care, what we're referring to. We are referring to the delivery and or the coordination of high quality health, either medical, oral, or behavioral and social services in a person-centered manner with the goals of improved health outcomes and more efficient and effective use of resources. And just to clarify what we mean by high quality, it is care that is accessible, person-centered, which includes anti-racist and culturally responsive. It's integrated, comprehensive, continuous, team-based, collaborative, but also trauma-informed. Witnessing increased coordination and commitment among systems within the health science ecosystem would begin to address health equity in the Kansas City region. In addition, we have seen the impact of our health workforce with this pandemic. Many of you have seen that. Our region is facing a declining health force population. And in turn, we center efforts that advance an inclusive and culturally responsive health sciences workforce. Of course, I can't speak to people purpose area without highlighting the importance of strengthening the capacity and effectiveness of essential partners in the community. We define essential partners as those without them, we cannot achieve our strategic outcomes. This includes partners across the full spectrum, which is we speak to prevention, treatment, recovery, and advocacy. Essential partners are deeply connected with and responsive to our communities of focus, which Kiana spoke to earlier. Last but not least is our powerful area. It's power. Just kidding. Quite frankly, each of these purpose areas work in concert with one another, and it would be most challenging to be able to stand either of them up on their own. It is in power where we work with the community to strengthen community organizations and voices, capacity building, leadership, and connectedness. It is in this space where we work to learn together the importance of power sharing in philanthropy. Our focus in advancing participation in democracy is with the intention to address the effectiveness of community organizing and civic participation. And to wrap up this plan is a reiteration of what Kiana shared just a little bit earlier, is the communities of focus will be the lens in which we use in leadership, resourcing, and our advocacy. So what do we need to know? Moving forward in the slide. I'll give you a moment, Ross, to pop that up.
Yeah, thanks. 1 second, Angie.
No worries, no worries. We're going to talk a little bit about what we might need to know based on what I just shared as far as the purpose areas, so that you have a clear understanding of what some of this may mean moving forward. So I mentioned about the importance of leadership, advocacy, and resources in order to reach our aims. We will also hold ourselves accountable to live our values in this transition. If we haven't mentioned it yet, we find ourselves in a learning environment. In this transition, as such, we hold ourselves accountable to our values of trust, partnership, stewardship, learning, equity, inclusion, and anti-racism will be held up in our approach and our behaviors in this transition. In addition, we see our partnerships evolving through this process, and the need for cross-sector partnership will be very critical. You can shift to the next. Thank you. In addition, we will begin to sunset our healthy communities as we funded in the past, and will recast them within our whole person care and through our policy work. And while active living is important, health behaviors represent a smaller portion of health outcomes, and therefore will no longer be an area of funding. Funding beyond 2022, grants may be considered for partners outside of our purpose areas on a case-by-case basis. We understand the importance of being adaptable and nimble enough to respond to the changes within the community. And not only that, the overall ecosystem. So we will consider partners outside of our purpose areas that I've stated earlier on a case-by-case basis, moving beyond 2022. You can shift, next slide. Thank you. So we'll give a quick update on where we are with our current grant making process. We approached 2022 grant making with, we approached grant making in 2022 with the intention of ensuring our legacy partners were funded. Legacy partners are those whom consistently funded and those who we funded in the previous year in 21. This also includes several partners who several partners who we may have funded prior to 2021 that aligned with the foundation's previous strategies. So let's begin with our safety net funding, which has been ratified by our board of directors. The majority of these grants are unrestricted, but the safety net team determined a small number of grants should receive flexible funding that targets a specific program. They will run through June of 23, which includes an additional 6 months of funding to support transition of our partners during this development period. Each of our funding teams will conduct check-ins in lieu of interim reporting to be a thought partner with our grantees as they work diligently serving the community needs. Our healthy communities, I'm gonna grab a drink of water. I feel like I'm getting dry now, Kiana.
It's easy to do. Cotton mouth is very real when you're presenting.
It's the truth. Our healthy communities and our mental health funding will run concurrently this year, coming to a close in June of 23, just like our safety net rounds. After our staff review process, our program and grants committee will review the slate in April and followed by our board, which will ratify in May. We will be in a continual conversation and communication with our partners during this time, assessing the support needed and the potential for connecting them to other partnerships and collaborative efforts that will support this transition, should they find themselves absent from our funding in our newly developed funding round in 2023. It is a standard practice in philanthropy to support a transition like this for at least 6 months, or even to a year. Given the strength of our relationships and the work of our partners we've engaged in our community, we felt it's important to award an 18-month of funding transition to address additional transition needs. And we will also address additional transition needs on a case-by-case basis after the June 23 as well. You can shift to the next. Thank you, Ross. Looks like spam and is getting in the way of good work, Ross, from what I can see. So let's shift to our applicant defined grants. This is an area where there's not been a lot of change. There has been some change in our cadence. So our applicant defined grants will be offered in March, May, July, September, and November, with our awards being announced within 45 days of the application. There will be no changes to the application proposal process. And we have had an opportunity to increase our funding in our ADGs, as we call them, from 4 million to 5 million this year for 22. The request amount for organizations will still remain at 75,000, and there will be an ADG pre-application survey available to facilitate the scheduling of a consult with the health board staff should you need more to get more questions answered or additional support as a part of the process. Funding will continue based on the applicant's determination of need, should it be consistent with health board mission and our service area. Applicant defined grants will continue to support 4 funding categories, which are core operating support, capacity building, program support, and innovation. So you can expect that that has not changed and will remain. So what's next? We can shift to the next slide. I know that's a lot of information that you just heard, but know that we are here to support you. Whether it's via our website, relationships with our team, a call or meeting, know that we are here to aid in this process and won't leave you hanging with all the information that you heard. Hopefully you weren't writing feverishly to get everything written down. So we will be sharing our new purpose initiatives and of course, listening to our community as we develop indicators for success. We plan to share our initiatives in alignment with our strategies and outcomes by early spring. So be looking for those in March, and we are engaging the community's voice in developing our indicators for success. So we're excited about that aspect to not know that we don't have to go it alone, that we have a community's support as a part of that process as well. In addition, we're sharing new funding opportunities we hope to do in the fall of 22. You can also expect to hear more about that as we ramp up to our new funding strategies. We're exploring and learning with intention and with an intention of adopting a trust-based philanthropy approach with an equitable evaluation process alongside. So it's really, truly exciting times for us as it relates to philanthropy and the work that we do moving forward. So in the meantime, we invite you to stay engaged and follow us on social media sites, as well as if you haven't, sign up for our newsletter, as it'll be another area as that we are able to keep you in the loop of what next steps we're taking. We'll continue to blog, we'll stay engaged with social media, and we'll keep you in touch with the latest information. Thank you so much for being able to stay in connection through this presentation process of many words and lots shared from Kiana and I. We again appreciate so much that you've had the opportunity to join us this morning. Jen, I believe you'll be moving us on to the next section.
I'm wondering if Jen dropped off.
So am I.
Let's see. Okay. Well, let's move on to our question and answer segment. And before we jump into that component of the segment, I just want to thank all of you because you've been patient as we have figured our way and found our way as we've learned with our board and staff and community advisory council. You've checked in multiple times along the way, asking, where are you? What can you share? What do you know? And oftentimes you found that we were giving you the same response. And I'm sure that may have been frustrating and a little anxiety producing, but I hope we were communicative throughout the process and that your program officer, who we now have retitled to impact strategist, stayed in communication with you about where we were along the way. So thank you for sticking and staying with us as we charted our course We're going to move to the Q&A segment.
I'm on cue.
Okay, all right, go ahead.
Sorry, everyone. I logged in from my phone and it muted me. I want to thank everyone who has emailed questions ahead of this meeting. We received quite a few. Some of them were similar, so we've grouped them together. We're going to go through those first. We're still monitoring the chat, and we've seen some other questions that you guys have already put in the chat. So we'll be adding those questions into the session as well. For any questions that didn't get addressed, we're planning on adding all of these questions and answers to our FAQ page on the website. So pay attention to that. And then also, as Angie already mentioned, please feel free to contact her or any of the program officers or staff at Health Forward with any additional questions that you may have. Everyone is available to answer any questions to the best of our ability. So with that, I'm going to kick it off. Angie, Graciela Cuchnell, and Kiana are going to be fielding some of these questions. So Angie, I'm going to start with you. And the first question that we have is, with the new plan, do you foresee the possibility of you funding organizations that previously have not received funding in the past?
Our purpose plan will require a collective effort with both existing and new partners. While some existing partners will still fit within the new initiative, some may not. So as we remain open to feedback and transparent about how partners can work with us in executing our new purpose plan, an important thing to understand is that with our new purpose plan, we aren't focusing on just grant dollars. We are also engaging, as I talked earlier, around advocacy efforts, and our policy advocacy resources efforts are growing the community understanding around civic engagement and around race, health, and economic equity. This work will require many kinds of partnerships, and there may be new collaborations that we extend beyond our grant making. I think that's probably one of the most important things to recognize is that, and an excitement that we have as well, is that our opportunity will be able to engage with maybe new partners as well.
Thanks, Angie. Graciela, I'm going to turn this one your way. There's a question about our eligibility criteria. And with this new purpose, have there been changes around who's eligible to receive funding?
Buenos días, everybody. Yes, so the short answer is our eligibility criteria has not changed. While our outcomes and strategies have changed significantly, as you probably heard from the presentation from Angie and Kiana, we did not change our eligibility criteria. You can find our current eligibility criteria on our website. It remains unchanged. That information can be found if you go to the Before You Apply section. You also might want to check the frequently asked questions. Sometimes we answer questions that might be helpful related to eligibility there. Moving forward, we're going to continue to assess and review our eligibility criteria to determine whether we need to make changes in order to align with our new purpose. So hope that helps.
Thanks, Graciela. Kiana, a couple questions have come in around our new purpose and eligibility, but around the organization and their board. What if their board is white-led and lacks diversity? Are they still going to be eligible?
Yes, organizations that are white-led and lack board diversity will be eligible for funding. However, given our communities of focus, we do expect movement and progress among our partners in diversifying their board, staff, and leadership for that matter. Our intention here is to first ensure that our organizations and their governance and staff reflect who they serve. And I think that's what we all seek. And we want to ensure that our partners and your strategies for serving the community align with our 4 new purpose areas and that we have a melding of the communities that we seek to serve within our new purpose framework. So we understand that many boards are challenged in cultivating a diverse board, and we seek to support you in that realm. So as we phase our work over the next 5 years, we will provide some field building opportunities and some capacity building opportunities to support organizations in diversifying their boards and to ensure that our organizations who we partner with are comprised of multi-identity, multi-ethnic, equitable boards.
Thank you. Angie, I'm going to toss this one to you. The question is, would Health Forward connect organizations where they see synergistic partnership possibilities? Would Health Forward help facilitate some of those introductory meetings?
Absolutely, absolutely. Quite frankly, in order for us to achieve our intended impact, we have to connect and identify opportunities for our partners to be able to collaborate through authentic partnerships and we will champion that collective work. It's, again, we know that with connecting and convening our partners together, that through that partnership, the synergistic partnership, that much work can be done and accomplished. So absolutely, this will be something, a new opportunity for us to be able to connect like organizations or like centered, focused in organizations to reach an impact. That will certainly be a part that we will play and provide introductory opportunities in that. Great question.
Thank you. Okay, Kiana, I'm going to read you this one. It is about conversations with other funders. So the question is, this change in vision leaves funding gaps. Has there been any coordinated conversations with other local funders to address these gaps?
So we have not coordinated to address funding gaps with other funders. However, the benefit of the 18-month, now 17-month bridge funding, if you will, that we've provided allows not only our partners time to adjust, but allows us time, right? We have a lot to plan and do, which will include engaging other partners to consider the gaps that have been created. We know that we are moving away from active living, and that healthy eating will be significantly recast to focus more on policy and to focus on that effort within whole person care. So understanding that, we will be engaged in conversations with other funders about the direction that they're headed in. And as Angie mentioned, where possible, will not be the case for most, but where needed, we will provide transitional funding on a case-by-case basis beyond the June 2023, and just know that conversations with funders will be underway.
Angie, you've addressed this one somewhat in your remarks earlier, but there's been a question around, is there an RFP available? When will there be an RFP available? And what are some of the new grant requirements?
Yes. So we will announce our new funding process in late fall. We, as Kiana just mentioned earlier as well, that we're still committed to the bridge funding that we provided for our legacy partners. And during that time, it gives us an opportunity to begin developing a new funding model to support our partners. And so we are taking into consideration the feedback that we receive through feedback sessions in 2020 and also in 2021. Also some research from highly successful foundation models and our community partners as we develop our new funding process. So we'll be underway with that, and we plan to announce what it will look like in the fall of this year.
Thank you. Okay, Graciela, I'm going to read you this one. Health Forward's been supporting healthcare for people who are underserved since the beginning and effectively advocating for policies that improve health. Does Health Forward have concerns over redirecting funds to social influencers of health? And what may happen in the interim if funds for healthcare access for the underserved decrease?
Thank you. So we still believe that both are important. So we will continue to fund both direct services and systems change as we move forward. We talked a little bit, Angie mentioned that our approach to fostering healthy people will involve integrating whole person care across the continuum of care, which means prevention, treatment, recovery, and advocacy. So we will continue to support that work. We will continue to support and strengthen the capacity and effectiveness of our essential safety net, physical, mental, and oral health partners to provide equitable, centered care. But in doing that, we also have a commitment to addressing the conditions that create poor health as shared in our purpose plan. So we will continue to fund both.
Thank you. This is kind of about our communities of focus, Kiana, so I'm going to toss this one to you. The question is, I'm particularly interested in how the new framework strategies will include and support our rapidly expanding and often silent and painfully vulnerable aging population.
Great question. So our purpose areas and strategies do not prioritize our communities of focus by the lifespan. This really is done for maximum flexibility. It allows our partners and our work to be nimble as we pursue systems change outcomes that foster healthy people, community power, and equitable and just places across the lifespan. So as you've noticed, our plan does not call out children or teens or adults or seniors specifically. That is intentional as our work is at the systems level and not dedicated to the lifespan. It is dedicated to across the lifespan. Thank you.
Great, thanks. Angie, this is one you addressed in your comments as well, but I think it's worth answering again. What are Health Forward's thoughts and plans for supporting current grantees going forward after their transitional grants have expired? They added, these grantees have already achieved a large measure of health equity in order to receive current funding, but it's unclear how they may fit into a new strategy.
You're on mute.
You're on mute, Ange.
I knew someone was going to do that today, but I thought it was going to be Graciela.
Yeah, it's hard to mute me.
Well, what I was saying that was really important was we can only achieve health equity through our partners. So decisions on funding for those that fall outside of our funding opportunities after our transitional funding ends will be on a case-by-case basis. So please remember that funding may end, or while some may fall outside of our new funding streams, our new purpose plan doesn't just focus on grant dollars. So we'll also engage with our partners as it relates to advocacy efforts and growing community understanding, civic engagement around race, health, and economic equity will all be important as we move forward.
All right, again, this is another one that I think we've touched on in the presentation, but worth addressing again. We've received a couple questions from some of our Healthy Communities grantees around how does healthy eating and active living fit into the new purpose areas. So Kiana, I'll toss that one your way.
Sure, it never hurts to continue repeating the information because we have shared a lot with you and we want to ensure you're clear. So grants solely focused on healthy eating and active living will end after June 2023. Let me just take a moment to acknowledge the great work we've accomplished with our healthy eating and active living partners. We have advanced substantial work, made great strides across our region, from providing access to bikes and parks and green space to creating bike and walking trails supporting numerous community gardens and nutrition education, the whole gamut. That's great work. And we've made great strides at the individual impact. However, we will begin to sunset the Healthy Communities area as we funded it in the past, and we'll recast the healthy eating component within whole person care and through policy work. So that's for healthy eating. It will be recast through whole person care and through policy work. Active living is very important. As we know, all health behaviors are very important. But as Angie shared, the evidence is clear that it represents such a smaller component of health outcomes, juxtapose socioeconomic and environmental factors. And so we will be discontinuing all active living funding after June 2023. We will continue to support direct service delivery, as Graciela mentioned, and we'll focus our work on addressing those systemic issues at the upstream level as well as direct service.
Thank you, Kiana. Graciela, there's a question about our rural partners and how do rural communities fit in the new purpose areas and strategies?
Sure. And if you look at our communities of focus, it's very clear that our strategies will prioritize people who experience the greatest injustices and health outcomes. And that, of course, includes people in rural areas where we know that systemic barriers get in the way of optimal health. So our purpose areas will address many of the challenges that rural communities face, such as access to health care, lack of hospital available in the areas, Medicaid expansion, digital equity is an area of need. Amplifying power and voice in civic matters is a good way to bring the community together to address some of those and inform our strategies. And then healthy housing and home ownership are other areas that are barriers in rural areas that we seek to address.
Thanks for clarifying that, Graciela. Kiana, this one is related to the place purpose area and our work around housing. So the question is, will a focus on affordable home ownership include more than new builds and rehabilitation of vacant structures? What about unsafe or unhealthy structures that are currently owner occupied? Does safe and healthy consider neighborhood conditions?
Thanks, Jen. So our primary goal in the place area with respect to housing is to support pathways for affordable home ownership, because there is a strong link between home ownership and health, and housing and health, and to create wealth building opportunities, given that home ownership continues to be a primary means for accumulating wealth. And the provision of economic opportunity and access to capital for multi-generations and all the things that you're familiar with respect to home ownership. We also seek to support housing, recognizing that home ownership is not everyone's goal. So healthy housing will be a component. It will not be the main thing, but we know that we have to address housing and home ownership integratively. With respect to neighborhood conditions, it's a little different in that we view this work as very much intersectional, and we recognize that safe and healthy neighborhood conditions encompass many things, and that these issues that we are focusing on intersect with safe neighborhoods. So our purpose plan investments, including leadership, advocacy, and resources, will directly or indirectly impact neighborhood conditions. However, we will not be focusing with direct funding on those necessary conditions. Hope I answered that question. Solving for all things in the neighborhood conditions realm will require many resources outside of Health Forwards, and so we welcome the opportunity to partner with those interested in safe and healthy neighborhoods, and opportunities to leverage our resources with other organizations who are committed to advancing home ownership as well.
Thank you, Kiana. Graciela, questions come in around, will grants still include support for indirect cost? Could you address that one?
Yes, and I think we believe that having effective and strong organizations lead to better programs and better services. So we recognize that core support as flexible funding is important. I think during this pandemic, we all realize the importance of that. So we will continue to accept requests for indirect costs.
Great. Okay, Ange, trying to keep up with all these questions. Can you clarify when existing Healthy Communities grantees will hear if they've received transitional funding for this year?
I'm sorry, can you repeat that? I'm
Sure.
sorry, I missed that.
Sure. Can you clarify when existing Healthy Community grantees will hear if they receive transitional funding for 2022?
Yes, they will be hearing about that as a part of their funding round. So as Kiana mentioned earlier, our impact team is making phone calls and having conversations with our partners right now about the next process. And some of it is what we're speaking to today. And so you can rest assured that you won't wake up in the middle of the night in a cold sweat wondering why your grant ended. We will be proactive in reaching out and ensuring that you were made aware of your process, as well as when the new funding cycles will take place. Also have those conversations about what alignment might look like moving forward as well.
Thank you, Angie. Okay, Kiana, I'm going to give you this one. You didn't specifically mention the advocacy policy grants. Do you have more information on those?
Certainly. So we are in our third year of policy and civic engagement grants. So we launched those in 2020. We've spent about $1 million a year on those investments. Since that time, our board is in the process of reviewing extension of our policy and civic engagement grants for third year, again, as somewhat of a bridge. And we will take the remainder of this year to recast what policy and civic engagement will look like moving forward. And so I would expect for you to hear about that around the fall as well. And know that beyond policy and civic engagement grants, a fundamental component, the fundamental component to health equity is power. Health equity is about shifting power, money, and resources. So when you look at our power section of our purpose plan, you will see that amplifying democracy in our communities is a part of that power purpose area. And we will engage with the community around those funding opportunities in the fall.
Thanks, Q. Okay, Ange, this one's right up your alley. Could you address trust-based philanthropy? What do we mean by that? And just talk more about trust-based philanthropy.
Oh, absolutely. It's a concept in which we feel very, very excited about, because it really begins to address the relationship that we have as an organization with our community. It begins to address the importance of power sharing and recognizing that our partners in the community know what's going on in the community and trusting that they do. And then therefore, our structure, our processes by which we serve the community change and adjust based on the needs of the community. So it's about being less prescriptive and allowing an opportunity to simplify our process, recognizing that our partners, some are smaller, some are larger, some have grant writers, some do not. And so how do you engage in a process that makes it level set it for all? And so we look forward to continuing our learning and development, not only with our staff, but also with our board, engaging them in this process. We look at and we recognize through a trust-based lens that in order for partners to have success within the community, one annual grant is not going to allow you to reach the impacts or success that you would like to make. So we are looking at multi-year funding opportunities as well in relation to trust-based philanthropy. And so trusting that our partners know the answers, have the answers within the community, going to you, sharing power in that process, and trusting you to do the work with the awards that we're able to fund. Again, is not just about grant making, it is an organizational wide shift and change. I hope that gives a little bit of understanding, and feel free, my colleagues, if you'd like to build upon that.
I think you covered it.
Great. Okay. Kiana, this is a question around our communities of focus. And we've touched on this a little bit, and I think the Curb Cuts video also hit on this, but I'll ask it again. People with disabilities share race and economic inequities that are exacerbated by their disabilities, but they often seem overlooked as a communities of focus. Will they be a specific part of your work going forward?
People who are differently abled have always been a part have always received Health Forward funding, and we don't envision that changing, provided that the areas of focus for people that are differently abled align within our purpose plan. So there's not a specific call out for folks that are differently abled, but it's really aligned around the areas of whole person care, of place, and what that looks like. So there may be proposals or requests to partner around place components, digital equity for people that are differently abled, and we welcome that.
Thanks, Kiana. Graciela, I'll toss this one your way. Does whole person funding include workforce development in our people purpose area?
Yes, it does. What we're trying to accomplish with our workforce work or focus is to really expand, broaden diversity in the workforce. And so it does include, as you said, whole person care. And whole person care, just to remind you, is the whole spectrum of care: treatment, prevention, recovery, and advocacy.
I will add that we have been listening for a while to our partners, our safety net clinic partners, FQHCs, community mental health, behavioral health centers, public health organizations. They've all shared that workforce is their principal challenge. It's what keeps them up at night. I was just speaking with one of our FQHC CEOs, and they mentioned that there's a shortage of medical assistants. There's no one to room people and take blood pressure. Mm-hmm. So that's a concern for us, just as much as it is about there being not enough people of color in roles of nursing or physicians or analysts, for that matter, clinical analysts. So as we think about our unique positioning around health sciences, we are looking to not just create new jobs, but how to advance people who were already in those jobs with a specific focus on Black, Brown, and rural talent.
Thank you. Okay, we have another question around, Graciela, I'm going to toss this one your way. It's around evaluation. Are we eliminating your metrics requirements?
No, we are not. We think, and our board strongly believes that making sure that we can tell our story of progress, what we are accomplishing, is important. So we will continue to use mixed methods. Now, I might qualify it a little bit as following the conversation on trust-based philanthropy. And for those of you that are familiar with equitable evaluation, we are also reviewing other non-traditional ways to make sure that we can share with our partners to be able to tell the story of progress and impact that we are accomplishing with their support and help. So we will continue with metrics. Mixed methods will be part of that. And we hope to learn more and apply more new approaches that are beginning to be prevalent in philanthropy that both respond to trust-based philanthropy and equitable evaluation.
And I might
not too
add,
much.
oops, I'm sorry. I was just gonna add to Graciella's statement, and one of the mixed methods that she speaks to that we've had a lot of dialogue around is lived experience, and how important it is to, in our evaluation process, to elevate, recognize, and trust lived experience as a part of how we evaluate as well.
Thank you. I know we have a lot of rapid fire questions here, so sorry about that. You're off the hot seat in about 10 minutes. We have about 10 minutes left, probably about 10 more questions. I think we'll be able to hit a few more. And then again, we can update our FAQ section of the website. And if we didn't answer, the offer obviously stands to call and ask any of our impact team, program team, your question. We keep getting questions around healthy eating. So I think it's worth hitting this one more time. So Angie or any of you three, does this mean that healthy eating partners who do not provide direct service will no longer be funded?
I can take that to start. It may, in terms of healthy eating partners who there was a question, Jen, who are only providing direct service or who are not?
The question was who don't provide direct service.
Who don't provide direct service. So we are looking to take our work in healthy eating more upstream. We are looking to impact policy with respect to food and nutrition policy to include not just city local policy, but also Medicaid payment policy around food. So that is what we mean to more big P policy. That doesn't mean that the organizations who have been driving great work around little p policy, kind of, excuse me for the nomenclature, but and big P policy may not be engaged in that work. So we will share more around our initiatives in the spring, as Angie mentioned. This particular area for healthy eating will be clarified with respect to when those initiatives are shared in the areas in which we are looking to focus. It will be much more, excuse me, it'll be much more focused with inclusion of a policy focus. So more to come in the spring, and your impact strategist will be in communication with you concerning the healthy communities partners. But they will narrow. We will always be transparent with you. Our healthy eating partners will narrow.
Thanks for clarifying that, Kiana. I think I'm going to toss this one to you, Graciela or Angie, either. Question is, how do we define rural?
Let you take that,
Define primarily, to begin with, I guess, we define it by our service area. We have two areas that we consider rural, and that's Lafayette County, and Allen County in Kansas. So those are the 2 service areas that we currently serve as part of our the way we were set up. I don't know if there's anything else that
Yeah.
Kiana or Angie want to add.
I agree, just to add a little bit more color. So we have very defined service areas that we must fund in addition to Allen County, Kansas, and Lafayette and Missouri, Cass, right?
Yes,
County
sorry.
is,
Yes.
much of that is rural. We fund a sliver of the Clay Plat, and so much of that is rural. And so there are components of our communities, Eastern Jackson County, that are rural. So it really just it depends on the conditions of that county and that area in terms of how we look at our rural communities.
We have a lot of questions. I'm going to try and group some of these together around potential new partners. The first one is, would we consider working or consider funding worker-led organizations that are organizing in the job for safer work conditions?
Would we consider funding? Share it again, please.
Yes, sorry. Would we consider funding worker-led organizations that are organizing in the job for safer work conditions?
That is not an area we've contemplated. And so I'm reticent to say that we would.
Mhm. I agree. Mhm.
Okay, another is curious to know if we have plans to engage with businesses to address worker wages.
So we are actively involved with many civic organizations around different elements that impact health and wealth. And that is an area that might be contemplated, could be contemplated in our policy and civic engagement process. More to come. We have had long relationships with Missouri Jobs for Justice and the Heartland Center. And so we have those partners currently, and would imagine with our direction around racial equity and economically just systems, that our partnerships would continue to include those types of organizations.
Mhm.
Okay, a couple more related to new partners. This one's right up my alley. Will you be funding media organizations that specifically help amplify historically marginalized and underrepresented voices?
You want to answer it, Jen?
Sounds like you're up, Jen.
I mean, I'm not on the panel, but I'd be happy to. Yes, we have previously and want to continue to partner with media organizations, especially to help amplify this work. So absolutely, yes. And feel free to contact me about that.
Great response, Jen.
And you are part of the panel. Can't get out of this one.
All right, one more, and then I'm going to ask another housing question. It says, does Health Forward see any benefit or opportunity to develop relationships with private businesses and civic leaders to foster greater consciousness toward equity, diversity, and inclusion, to educate them on issues they've ignored in years past? I see Health Forward as a change agent influencer.
Great question. So yes, we have been in that space and will continue to be. So our purpose requires cross-sector partners. And we've partnered with the Civic Council and the Greater Kansas City Chamber of Commerce around Medicaid expansion in Missouri. We are in active conversations with the Chambers of Commerce and businesses on the Kansas side regarding Kansas Medicaid expansion. We currently are co-convening and co-leading, to your point, the Kansas City Health Equity Learning and Action Network. And so that includes not just the health ecosystem sector, but also includes those organizations are multi-identity as well, right? And so our hospitals are businesses, our health plans are businesses, and the Kansas City Health Equity Learning and Action Network is about creating shared understanding about health equity and fostering commitment and collective impact around how to drive anti-racism and health equity as both quality improvement as well as from a community change perspective. So we are certainly advancing that as we speak in partnership with many stakeholders across our region to include businesses. And I will also say quickly that businesses have a stake, right, in the health of our community. Of course, we saw that through COVID in terms of the economic peril that our community experienced as a result of that and the shutdown. So there's a business imperative to health. And we also know that our employers, who oftentimes are self-insured and may be insuring low-wage workers, there is an economic cost to health inequity. Employers pay when inequity occurs in health and in our community. And so it's imperative that we work across all sectors to improve the health and well-being of the Kansas City region.
Okay, we have 2 minutes and still quite a few questions. So we're definitely going to need to address some of these. And there's some real specific questions too. They're really good questions, but I think it might be a better fit to call and talk to a program officer on some of these. I'm going to go ahead and toss this one to you, Ange. We've addressed this, but I think it's important to say again. Can you again talk through our time frame on when people might receive information about the new funding cycles?
Yes, you will expect to receive information about our funding cycles, our new funding cycles, in the fall of this year. So that will be the first opportunity where you'll hear what our funding will look like moving forward.
Great. Okay, with that, we have a minute. So I don't think we have any time for anything else. Q, do you want to close us out?
I absolutely will. And thank you, Jen, for the rapid fire. And thank you to the community, our partners. We appreciate you. For those who are not our partners and are interested in partnering with us, thank you for coming to learn about who Health Forward is, who we've been with you, and where we're headed. We're excited about our future. We're excited to partner with you in new and dynamic ways. And most importantly, we are excited about impact, right? That's at the end of the day, we want to see our communities whole, well, and thriving, everybody. So we thank you for your patience, your understanding, and your partnership as we pursue this change. Thank you, and happy Friday to everybody who has joined us today.
Thank you, everyone.
Take care.
Have a great weekend.
Bye-bye.